Hey everybody, welcome back to What's for Dinner.
Hello.
Hope you all are doing well tonight. We're just checking in.
Yeah, very easy food, so we won't talk about that for long. I just did some burgers in the air fryer,
Yum.
and we only did 4, so.
Yeah.
And then I just did some bacon. I didn't even do eggs.
Also in the air fryer.
Yep.
So we're using the 70-30 on the ground beef, and so the higher fat content. And then we put the white cheese is baby Swiss. Those are mine, and then the yellow cheese is American. Those are for Teresa. And then we just do Sam's Club bought bacon. Okay. So hey, just real quick question: will either of these cause your blood sugar or your insulin to spike?
They will not. So if you're just eating protein and fat, your blood sugar won't spike. And so I titled this, I've been thinking about this a bit, can diabetes be reversed? Type 2. Type 1 can be significantly reduced where your insulin requirements can go almost, we met one guy at a conference, his insulin requirement was down to 5 units. So your type 1s, your insulin requirement can go down a lot. And type 1s get insulin resistance. So they get type 1 and then later on they lead into type 2 where you get insulin resistance. You don't want that. So I found something on Facebook. Dr. Richard Bernstein is a medical doctor. He's an endocrinologist, but he started out his career as an endocrinologist.
Engineer.
He started his life off as an engineer. He had type 1 diabetes way back when the survival rate was not very long, the life expectancy. His wife was a doctor, so he was able to get a glucose monitor to check his glucose, his finger sticks. And once he started figuring everything out, he started going to these endocrinology meetings and such and trying to tell doctors, look, if we do this, manage our blood sugar, our food, our blood sugar is this, and then you cut down on all the side effects and all the problems that go along with diabetes. And they wouldn't listen to him, they wouldn't talk to him because he wasn't a doctor. So he went back to school later in life, and now he's been an endocrinologist for the last 40 years. He wrote a book called Diabetes Solution. But anyway, in 1976, he wrote the American Medical Association, the AMA, and told them what his findings were after he became a doctor so he would be listened to. And the AMA wrote him back and paraphrasing that he was a little overzealous and no patients are too lazy and too dumb and they would never be as conscientious as he is about his health. And so the hair on my head just stood up.
Yeah, they're making the decision for the people.
Right, so my thing is let people decide. Yeah. I sometimes know when I'm talking to someone in the office when they're not ready to change their diet yet, or it probably won't happen. And then sometimes I'm wrong too, but I can sleep at night because I've given people the appropriate information for them to then go make a decision or a change. It took me a long time, but I've also realized that sometimes I am here and my job that God gave me is to plant seeds. I'm not always going to see the fruits of that labor later on. 10 years from now, someone might change their diet and I might never ever know about it, but it was because I planted a seed. So let's not ever think someone is too dumb or too lazy. Just like now, doctors say or providers say, people are too lazy to change their diet and exercise, so we just give them the GLP-1 injections for weight loss. Well, if no one is given the right information, how are they able to make an informed decision? If you're sitting around following the American Diabetic Association diet recommendations, your diabetes is going to be chronic and progressive. So Dr. Bernstein, who I was just telling you about, went around after a while to endocrinologists and said, why aren't you giving people the right information? Like, what are you scared of? And so basically it boils down to this. If you have a type 2 diabetic patient and we say the standard of care is that disease is chronic and progressive, they're eventually going to lose their sight, they're eventually going to go on dialysis, they're eventually going to get limbs amputated because of diabetes. That is acceptable because that is standard of care. Standard of care for a diabetic is most likely kidney failure, retinopathy, and amputation. However, like my type 1 diabetic, he collapsed because his blood sugar went to 40 or 50. The EMS had to come. You're in danger of having a seizure and dying. They've told in surveys they don't want, if that happens, you're going to be sued. If your leg gets cut off because of diabetes, no one's going to sue you because that's the standard of care. We all know it's a chronic and progressive disease. Does that make sense?
Yeah, so just to back up a little bit though on your type 1 diabetic patient who passed out and stuff. So that was a patient, you put them or you recommended a low carbohydrate diet and they had not adjusted their insulin appropriately based on that recommendation you made. And so it caused a problem with them.
Right. Or diabetics, sometimes when they get sick and they don't realize it, you can have a fall in blood sugar. But yeah, he had been a diabetic for so long that it was kind of scary decreasing his insulin dose and not really understanding. Now he understands great.
Now he understands. But
yeah.
he adjusted, and he's one of the most fantastic like case studies you've had as
Right.
far as people
Ever.
who have, yeah, he's done great.
Yep.
So, okay. And now, so let's back up a little bit. You started to talk about type 2, whether it's reversible or not.
Mm-hmm.
What can people do to reverse it?
Stop eating as many carbohydrates. So what the American diabetic educators or nutritionists tell you to do once you're diagnosed with diabetes, okay, you fail, and this goes for the same as gestational diabetes. Pregnant women, when they go fail their glucose tolerance test, that means they have prediabetes or problems with sugar. They're told to eat then more sugar than the test failed them at. The test is about 100 grams of carbs that they failed, okay, and then our recommendation to diabetic patients is to eat 50 to 60 grams of carbohydrates per meal. That's 3 meals a day, plus 3 snacks at 15 to 20 grams of carbs a day. Okay, I don't know what that is mathematically.
Pushing 200 carbs.
Well, this alone is 150 to
Right,
180,
right.
and then this could be another 60.
Right, so we're pushing around 200.
So if you have diabetes, you have a carbohydrate intolerance, okay? You have to take away carbohydrates, therapeutic carbohydrate restriction. It doesn't sometimes have to be really low, but if you want to reverse these things, yes. If you follow the American Diabetic Association recommendations, your diabetes will be chronic and progressive. It's going to make you sicker and sicker and sicker.
So that to kind of summarize what you said, the glucose tolerance test that the people took provided 100 grams of glucose or carbohydrates, and you drank it, and they failed that test.
Yes.
After they failed it, they're like, oh, we need to put you on a diabetic diet. That diabetic diet has more than 100 grams. Now, it's spread out throughout the day,
Right.
but it's still considerably more than the number that you failed at.
Right.
So what are we doing here?
So 150 plus 600, whatever that is, or 60, it's like 210. I mean, so it's like telling a person with peanut allergies, like, your no peanut diet is pretty restrictive, and I don't know how you're supposed to live like that. And it's your birthday, and peanuts are your favorite. You should have peanuts. Just make sure we have 2 EpiPens instead of 1. Okay, that's what you're telling people. The American Diabetic Association is trying to tell people to portion control. Okay, we all know ex-addicts or current addicts. Go ask them if their addiction is moderated by half a line of cocaine or half a glass of scotch. Ask them if they can moderate that.
Yeah, it's not okay to walk into an AA meeting, your local AA meeting, with a case of beer and start offering and say, hey guys, have some beer, just do it in moderation.
Yeah. You're here, you're making an effort, it's a reward.
We talked about this the other night too, and how the studies on rats, the alcohol and cocaine were not as addictive as sugar.
Yep.
So which is crazy, and yet we treat sugar like it's totally fine. You're checking out in the checkout line at the grocery store, and there's just what is all in your face right there. You go down the aisles of the grocery store, especially the cereal aisles and the chip aisles, and it's all right there in your face.
Yep.
All the stuff that you're addicted to. The food companies know it. The grocery stores know it. Insurance companies know it. Everybody knows it. It's a big game, and
everyone is in cahoots against you. You're the only one that loses. Everyone else gets money and profits, and their board members are happy, and you're the one losing. You're the one with fatty liver, diabetic retinopathy where you're going blind. All these things could be avoided if you change your food. But your doctor's not going to tell you to do that, whatever provider, endocrinology, because they're not going to have you calling in or all their patients calling in saying, I just passed out on the floor, like my diabetic patient did to me on his wife, on a Friday night while I'm getting a pedicure after work. I took that phone call because that's what I do. But I don't have 1,000 patients like some of these people do. And if you don't teach and all that stuff along the way, they're not going to take the time with this. First of all, they don't know it.
Yeah. Well, the good news is you guys are armed with this information now, and we're here. We're going to continue doing this, and we're always available. If you have any questions, just reach out to us. You can message us however you like. Call the office if you want to. And is that all you have?
Yeah, it just makes me upset for
Yeah,
people.
this is hard. This is hard to deal with because you see it every single day.
Yeah.
Excuse me. But yeah, we love you guys,
Yes.
and we will see you guys next time. And God bless you all.
Yeah.
Bye.
Bye.